Top 10 Common Headache and Migraine Causes or Triggers. Hello guys, welcome to Just Top 10. A pounding head can be the result of many everyday things, from your stressful commute to that takeout meal. According to a National Institutes of Health survey, when it comes to the most common types of pain people experience, migraine and headache are second only to back pain. But while you might think an occasional headache is an unavoidable part of life, the truth is that you can sidestep many of your headache triggers. Here are 10 common headache and migraine causes that you can control, avoid, or anticipate. On number 10, let's start with alcohol drinking. Any type of alcohol can cause the blood vessels in your brain to swell, which can cause headache pain. But red wine may be the worst headache trigger because it contains tyramine, histamine, and sulfites, all substances that have been linked to headache. To avoid this type of pain, you can switch to white wine, eat while you drink, limit alcohol to 1 or 2 drinks, or avoid alcohol completely. Number 9 trigger is various medications. Many common medications, including hormone replacement pills and certain blood pressure drugs, can be headache triggers. However, the most common cause of frequent headaches may be the medications you take to avoid or treat your headache in the first place. Overuse of over-the-counter pain relievers can lead to a cycle of rebound headaches that go away only if you wean yourself off the medicine. Talk with your doctor about your medications, especially if you are taking OTC pain relievers more than a few days a week. On number 8, trigger we have is weather changes. If you're prone to getting headaches, you could find that grey skies, high humidity, rising temperatures, and storms can all bring on head pain. Pressure changes that cause weather changes are thought to trigger chemical and electrical changes in the brain. This irritates nerves, leading to a headache. How to fix it? There's not much you can do to change the weather. However, by looking at the forecast, you can predict when you're likely to have a headache and take a preventative painkiller a day or 2 in advance. Number 7th trigger of headache is sleep disruptions. Not getting enough sleep and sleeping too much can both be headache triggers. Sleep apnea is a common sleep disorder that causes difficulty breathing during sleep and decreased flow of oxygen to the brain. Studies show that about 20% of people with sleep apnea and 25% of those with other sleep disorders have headaches. To minimize your headache risk, try to stick to the same sleep routine every night. If you have trouble sleeping or snore heavily, talk with your doctor about getting tested for sleep apnea. Number 6th trigger of headache is cigarette smoking. Both smoking and inhaling second-hand smoke can trigger a headache. Nicotine is a vasoactive substance. That means it changes the size of blood vessels in your brain, and that can cause headache. Cigarette smoke can also trigger headache pain by irritating your nose and throat, or by causing an allergic reaction. This one is an easy fix. Don't smoke and stay away from smokers. If you are a smoker and are itching to quit, good for you. The good news is that there are a number of therapies available, and usually, a combination of medication and behavioral strategies is recommended. Number 5 trigger of headache is cold and flu. Headache is a common symptom of both colds and the flu, the result of your body's inflammatory response to the virus causing the cold or flu infection. Flu viruses cannot multiply in high temperatures, so your body raises your temperature, resulting in a fever. This causes your blood vessels to dilate, increasing the pressure inside your head, causing feelings of heaviness or pounding as well as pain. In addition, headaches can be worsened by sinus pain. It may lead to increased pressure around your face and eyes, worsening your headache. You have a good chance of avoiding the flu by getting a flu shot, but studies show that there are more than 200 cold viruses, so you may not be able to avoid them all. What you can do is wash your hands frequently and avoid people who have colds. Number 4 trigger in list of headache trigger is Chinese food. If you get a headache after eating Chinese food, the cause is most likely the food additive called MSG, or monosodium glutamate, which is used as a flavor enhancer and as a meat tenderizer. If you are sensitive to MSG, a headache can come on in about 30 minutes. Your best bets are to ask that restaurant food be prepared without MSG and to carefully read labels on foods you buy. On number 3, headache trigger is caffeine consumption. Caffeine in small amounts can actually be good for headache pain, and it is included in some headache medications. But if you get used to taking in lots of caffeine through coffee, tea, or soft drinks, you can get a rebound headache if you don't get your daily dose. According to research done at Johns Hopkins University, headache is a common caffeine withdrawal symptom, occurring in 50% of regular coffee drinkers. Avoid this headache trigger by gradually reducing your caffeine intake. On number 2, headache trigger is chocolate eating. There are some aspects of chocolate that can bring about a headache. Various chemicals and components of chocolate may be triggers for headaches, and chocolate can cause reactions in the body which may lead to pain. Chocolate contains a substance known as phenylethylamine, which affects blood vessels in the brain and may trigger a migraine. Chocolate also contains caffeine, which can cause headache pain in some people. If you typically get a headache within 24 hours of eating chocolate, try eliminating it from your diet for a while to see whether the frequency of your headaches decreases. Top 1 headache trigger is stress. Stress causes the release of brain chemicals that can affect blood vessels inside your head and bring on a tension headache, also known as a muscle contraction headache, because many people tend to tense up their neck muscles when under stress. A tension headache is generally a diffuse, mild to moderate pain in your head that's often described as feeling like a tight band around your head. Research shows that up to 80% of people get tension headaches, and that about 3% of people have them almost every day. Avoid these headaches by identifying your common sources of stress and doing your best to avoid them. You can also learn stress reduction techniques such as deep breathing exercises or meditation. Managing a tension headache is often a balance between fostering healthy habits, finding effective non-drug treatments, and using medications appropriately.
Thank you guys for watching this video.
We hope you liked this video. If you want to suggest us any topic, please comment below in comment box.
Don't forget to subscribe our channel and press the bell icon.
Take care of yourselves, friends and family members. Bye for now.
Adios amigos.